Our next speaker is Dr. Mandeep Tumber-Bhela. Dr. Tumber-Bhela is a licensed clinical psychologist with over a decade of experience in health psychology, specializing in the integration of mental and physical health. She is highly committed to promoting physician wellness and brings extensive expertise from working in large healthcare organizations and private practice. Dr. Tumber-Bhela emphasizes patient-centered and culturally responsive care in her clinical approach. She is also a Joy of Medicine counseling provider. Born in Punjab, India, and raised in Washington State, she has made California her home since graduate school. In her personal life, she enjoys spending time with loved ones, prioritizing work-life balance, and staying active through regular exercise. Please welcome Dr. Tumber-Bhela.
All right. I'm going to try my best to get a hang of this. So welcome, everybody. I've had the opportunity to speak with a couple of you today, so I'm going to try to integrate some of those conversations. But thank you for having me. Thank you to Sam for bringing up this topic. And something I wanted to preface with as we start today is I'm sure many of you have attended something related to emotional intelligence. And today my intention is not to assess any of you or have like a trait assessment, ability assessment. It's really to help you to understand what exactly is emotional intelligence and things that you can take away. So I'm on the heels of a 3-day conference that I went to, and I was sharing with somebody that there were so many great talks I went to, so much like enthusiasm I had while I was there, and now I'm like, well, what am I implementing as a result of that, right? And so my intention and hope for today is that you all take away one thing, right? In these next 50 minutes, there's something that resonates with you and something you can take away and implement into your lives. I know that many of you have many commitments, right? So we want to make it really simple and tangible, and that's truly the goal of today. And I will go to my disclosures. There's really not many disclosures I have for you all. I am receiving an honorarium for this conversation today. The opinions that I express are solely my own, and I'm representing my private practice today. As Dr. Chuck mentioned, I have worked in large health organizations for much of my career, inpatient as well as outpatient. But something that I developed an interest in was physician wellness because of the amount of work that I've done with physicians throughout my career. So I encourage conversation. I encourage us having a dialogue about what we are about to embark on today. So again, this is really about setting a foundation for our conversation today, and I really hope that this resonates with you all. If you can't explain it simply, then you don't understand it well enough, right? So today you'll hear me really simplifying the content that I'm talking about, and that's not because you're not competent, it's truly because we want to make it tangible and something that is meaningful for your personal and professional lives. And you know, this is like the therapist in me, right? I understand that all of you whether you like it or not, are caregivers, you're parents, you have other commitments, you have colleagues, you're a mentor, you have a lot going on, you might even be in training right now. So again, making it really tangible becomes really important when you're leaving talks like this. And so moving that data to skill set becomes really important. So I'll try to mix it up a little bit, and hopefully we can achieve that. So the learning objectives. So the learning objectives are pretty simple today. My hope is that you get an understanding of what exactly is emotional intelligence, what's the relationship of emotional intelligence with medicine specifically, and what are some strategies that you can utilize on a daily basis, hopefully, to develop your emotional intelligence, as well as that impact on well-being. it's really nice to be right after the mentorship talk because that is a part of emotional intelligence as well. Some folks really talked about some of these mentors who have this awareness that, hey, like maybe this person needs sponsorship, right? Maybe this person just needs a chat. They need a quick text, a like, or whatever it might be. So that's a part of emotional intelligence as well, right? That awareness of what you need as well as what others need. And it will impact your well-being, and we know that from the literature as well. And hopefully we can bring that to you all. So, me being a psychologist, I have a couple of questions to get to know my audience. So this is the core and crux of this is, what was your intention today, right? When you came into this space, when you came to this presentation, what were you hoping to learn? Do you think this is an important topic? Do you feel like it's something that you've learned a lot about? You already know a ton? Do you know nothing about this and you hope to, just start the conversation? So what we'll do is we'll take about 2 minutes, and I encourage you to talk to the person next to you or behind you, maybe new people, get to know somebody, and talk about what's your intention today? What's the intention that you have with this conversation? Are there benefits to this conversation? Are there downsides? And so I'll give you all about 2 minutes to turn to the person next to you. There's a couple of questions up here too. And you all can talk for about 2 minutes, 3 minutes, and then we'll come back as a group and hear what you have to maybe bring. All right, so anybody want to share what came up for them or interesting thoughts? Yes.
Wait for the microphone.
Oh, thank you. Thank you.
Sorry, okay. So we were sharing here amongst our group that, we were like, well, we think we're probably pretty good with EI. We feel like maybe is it something that you're kind of born with? Mm-hmm. Or is it something that you can teach to people? And we were thinking about, that's what I was looking at. I'm a chief medical executive of a large hospital in the area. Mm-hmm. And a lot of the people that are in my office are people who don't have EI. Yeah. And so, how can they recognize that, or how can I help them recognize that? That's what I'm here to learn or see.
Yeah. I hope we can answer that or touch on that. Yes.
Well, John and I were just talking about how, I understand the concept of emotional intelligence, but both of us work in fields where either you're so exhausted or you're pulled in so many directions, or you're talking to consultants who are, grumpy because you called them at 2 a.m. to ask them about some kind of emergency. And so kind of understanding, like, what do you do in those moments where either you are lacking emotional intelligence or you're interacting with someone who for myriad of reasons also our intelligence is down in that moment, and kind of how do you have it when you don't want to have it?
Right. Yeah. No, great question. Hopefully we'll address both of those today. Anybody else? Final thoughts? No? All feeling good, confident, comfortable? All right. So I'm glad that you started this conversation, and something I didn't say that I realized I should have prefaced with is, remember that this is the beginning of the conversation, right? And so the hope is that when you go back to your residency program, medical school, your faculty position, your clinical position, whatever position, leadership position you have, that you build on this conversation, and because this is a much broader topic, and it has much more content than 50 minutes that we have today. So some of you mentioned you have a sense of emotional intelligence, and I'm sure that you've assessed your emotional intelligence at some point as well, right? So what is it? Emotional intelligence is defined as the ability to recognize and control one's own and others' emotions while utilizing this awareness for self-control and influencing emotions in others. So emotional intelligence is always about the self and the other, right? And then what do you do as a result of that? You're not fixing things, which I'm sure many of you are used to fixing things as leaders or clinicians. And it's not about sitting in terrible emotions, right? It's not about, gosh, this really sucks, this is so horrible, and I'm just gonna go down a spiral of things. It's acknowledging the space, acknowledging where you are, where everybody is, right? Are they too busy? Are they staring at their phones, right, while I'm giving a presentation? Is everyone engaged? What's going on there? And as a result, how do I respond to people, right? How do I stand up here and still maintain composure and have eye contact with you all, knowing that there's so much going on for all of you, right? So that's the crux of what emotional intelligence is. And although the literature when it comes to medicine is actually pretty limited, so I encourage you, those of you that are mindful of research and want to do research to really look at this and see if you can grow the literature, because we know some of the broader concepts of emotional intelligence, but when it comes to medicine, there's actually limited literature on medicine and emotional intelligence. From the limited literature, we do know that it actually is, higher emotional intelligence is helpful in increasing trust, communication, teamwork, safety, performance, essentially the crux of burnout, right, which is what some of you have talked about. So we do know that as a broader concept as well as specific to medicine, that it can really support folks in bringing down that burnout component. So this was your question. One of you mentioned trait versus ability, right? So these are actually the two ideologies that are held about emotional intelligence. So when you go out there and you're looking for a way to assess your emotional intelligence, you'll notice that there are trait-based assessments out there, and then there are learned behavior or ability-based. And what we will focus on today is a little bit more on that ability component. But, I was thinking about this a little bit, and think about some of your friends, or as you were younger and growing up, folks that were involved in leadership positions, right? And I think of leadership as a broad concept, like maybe they were, the captain of a certain team, or they were involved in ASB, which, that's what it was called when I was in school, but like student leadership essentially. And some of those people that just came with so much enthusiasm, right? They could stand up here as really young people and have the charisma and the input and output, and they could really merge those two together at such a young age. And so there's definitely a trait component, but it's very much mixed. Because it is a muscle that we can grow as well. It is something that you can practice, and it takes a lot of practice, right? Because as Sarah mentioned up here, we all get tired, right? We have so many competing responsibilities that we have trouble, keeping it together all the time and keeping, merging those two worlds. But it is a muscle. It is something you can practice. It is something that you can encourage your loved ones to practice, your team members to practice, and we'll talk about those particular pieces today as well. I encourage you to have a growth mindset around that. So when it comes to the pillars of EI, you will notice that there's 4 quadrants out there. I didn't give you the image. Like I said, it's all out there, but I wanted to keep these slides relatively free of clutter, right? But the 4 pillars include self-awareness. So we've talked a lot about that. That's all of you sitting in here, right? Like, what am I feeling right now? What am I feeling as this, lady up here is talking about emotional intelligence? What are my thoughts? What are the emotions that are coming up for me? What are my drivers, right? Is this relevant to my work? Am I enthusiastic about this? What's happening? The other component with the self is also self-management, right? So that includes your ability to control your impulses. So it's not yelling if you are not happy with whatever I'm saying, right? Not getting upset with things. It's having flexibility around the content that's being discussed or while you're in different spaces, right? If you're with your MA, not maybe yelling at them if they did something wrong or force booked a patient that you weren't really aware of and you found out maybe 5 minutes before they were going to be showing up. How do you have that distress tolerance, right? That's really the crux of this self-management piece, is how do you diffuse that anger if it does come up for you? And the next piece here is about the other, right? Empathy, which you all have a ton of, and as we go through our careers, life chips away at us, our professional experiences chip away at us, and it becomes harder to have empathy at some points in our lives than others. But what does that social awareness look like? What's your understanding of what's going on in spaces, in rooms, right, with that patient who always comes in about the same issue, but maybe this time around they do need that CT, maybe they need something a little bit more, right, active from your end versus a conversation. And how do you pull for that? How do you pull for that empathy? And that last little piece is relationship skills and social skills. So the top two were about yourself, and that last piece is relationship management, right? Some of that is mentorship as a part of that as well, right? How are you interacting with others? How are you facilitating conversations? How are you engaging in those conversations on a regular basis? And are you able to inspire people, influence people? Are they able to do that to you? Are you working well in teams, right? And that is part of our well-being as well, right? So if we just think about that just as we sit here, if we're effective, right, in our teams, we're gonna feel good about what we're doing. If we're effective with our patient care, we're gonna feel good about what we're doing. So just fundamentally, as I talk about this, I think it connects. But again, the literature is a little bit limited on it, but it really does connect with what all of you do, whether it's in leadership, whether it's in your family or your professional work. I really felt like this was important to talk about, and I spoke with some folks here earlier today as well. But I have the privilege of working in the Joy of Medicine work, and I've had a lot of work with medical students, residents, as well as professionals who are, earlier in their career and a little bit further, so that developmental trajectory. So I would love for you all to talk a little bit, and it would be interesting if some of you who are further in your career spoke with some of the folks that are students right now in medical school. And, what was your training like? Were you trained in the traditional American, right, medical model, or where was your training in particular? And I'm wondering, were you trained in assessing and what your feelings are before you step into a room, right? How important was that when you were training? And I encourage you to go deeper with that. What do you think the impact of culture was on this? And when I talk about culture, it's a broader concept, right? It's not just your race or ethnicity. It might be, what was the culture of your family unit? Were you raised in like Texas or New York or, the Pacific Northwest like I was? Or, what were your parents' professions? That might have had a lot to do with certain things. Or what was the philosophy of the medical school you chose, as well as the training that you had? And how did that intertwine with this? So again, I encourage you all to have, this is not gonna be a conversation you can complete in 2 or 3 minutes, but with folks that are around you, and again, really look for folks that are at different parts of their career, and talk about how important was this when you were training? And was it a part of your training? If yes, I would love to hear what was a part of your training. And if no, why do you think that was, right? And what could be done differently? Do you think it's important to have the knowledge of really pausing and reflecting, or the emotional intelligence piece of things? So again, I'll give you all about 2 to 3 minutes. And I will just wave my hands up when you guys are all done, when I'm asking you to be done and back into this space so we can get back to our conversation. So please feel free to talk amongst each other. All right. So let's come back as a larger group. So what came up for people? I heard a little bit about what some folks were saying in the front. Hello. Hey, everyone. All right. So back to the larger group. So I would love to hear some of the conversations that came up. Anybody really burning to share? Oh, I see the mic is going somewhere. Yep.
One of the things we discovered in our discussion was that when you meet a patient or you meet someone else, their disease is more than just disease. You've got to put it in the context of their life, and also recognize it in the context of your own.
Absolutely. Was that something that and so I have a follow-up. Was that something that you learned in medical school? Was that something that was like a learned behavior over time and trial and error?
Well, we were talking about the context of people's conditions and how they live and who they are. They're not just a disease, they're actually living within, and that disease is a manifestation of something that has happened through their life.
Absolutely.
And so the story of their illness is so vital, understanding kind of where they're at right now, but where they're coming from, and really looking at it in terms of story and being very creative in understanding that story. So some of the things that I use are, art, literature, poetry, really connecting to patients with that creative element, which I had to study in narrative medicine. So this is something that by implementing that into a practice, we really get more information, but more of the root cause sometimes to conditions.
Yeah. Thank you. So it sounds like you did some work in addition to your clinical training to get there. Yeah.
Can our med students, I think they have some insight.
Yeah, I would love to hear the medical students.
Sorry, guys.
Hello, I'm Jared. I'm a first-year medical student. One of the things that Dr. Bajwa and our group here were discussing was the idea of coming in, maybe like an MA giving you the heads up, oh, this patient's, upset, and just kind of cluing into, all right, what do I need to enter this room with? And Dr. Bajwa really mentioned just, you have to listen and kind of let that emotion that the patient brings into the room kind of diffuse so that you can get past that and address their medical concern. And that's something that I kind of resonated with as a scribe, because I would see the patients, before they saw the doctor, and I would usually kind of see that anxiety and that tension that they would bring. And it was more, front-facing. They would let it out more towards us because we weren't the doctor, And one of the things that Dr. Chuck had mentioned in one of our med skills courses a couple weeks ago was how to deal with difficult patients. You can't really let that MA who told you, oh, this is a difficult patient, just be ready. You just kind of have to let that go and proceed in a manner that's not going to be biased. So.
Thanks. Yeah. So it seems like you're receiving a lot more direct education about that, right? Good job. Great work. Yeah.
One of the experiences that I had last year with my preceptor was that we were going through and we were interviewing a SP as part of our OSCEs. And my expectation walking in there was to get the H&P as efficiently and correctly as possible, making sure I didn't miss anything. I wasn't missing the social history or chronic or something like that. And I remember at one point of the social history, we were asking about whether this patient was married, and she replied, no, I'm a widow. Now, granted, this was an actor, of course, but everyone in the room stopped for just a second. Everyone kind of held their breath. And then we attempted to continue as though we needed to keep going with the note. And my preceptor at the time stopped us, and he made a point and said, no. You always stop. There are some points of empathy that you always have to show. Loss of life, divorce, any kind of major trauma in their life, you always stop and you make a point to empathize with the patient, regardless of what happened for your efficiency. And that really changed my perspective on how we were going to be delivering that care, because it isn't just taking down their notes and making an effective diagnosis, but treating the person in that moment, which I think was really effective.
Yeah, thank you. We'll take one more thought, but thank you all for sharing. Oh, sorry.
I'm Caroline, I'm family medicine. Emotional intelligence is so important. I wholeheartedly believe it. Develop the rapport, empathize with the patient, despite the efficiency. And I don't know if I'm jumping ahead here, but how do we manage that in our practices? Because I love taking care of patients, but when they put the time on you, that really takes away from the whole reason why I feel like I went into medicine in the first place. So I don't know what the answer is. I feel like it's a systemic thing, and I don't know if we can come up with anything, but I just wanted to bring that up.
Yeah, thank you. That P word, productivity.
Oh, hi, I'm Andrea. I had a couple comments. We discussed on emotional intelligence, so I'm family medicine as well, and I've worked in community health centers since after residency, and also was a CMO, ACMO for several years, and working with the whole productivity and also being a family physician. Now, the patient population that we work with has a very challenging, and I always hear from my medical staff and the MAs oh, Dr. Casillas, that patient is very difficult. They're pissed off, they're mad, or oh, good luck, and I'm like, okay, but I think with emotional intelligence it's something you really can't be taught in a lecture hall. It's something that it's lived experience and understanding and listening to the patients. And the medical school I went to was Michigan State, and I think I saw another Spartan somewhere over there. And it's having that experience and understanding where the patient is coming from, and just Thursday, a patient was again very upset, and understanding and just listening, letting them vent, and saying yes, I understand, and having that, and that's one thing, and having my medical staff letting them know that no, there is no difficult patient. The difficult patient for me is finding out which inhaler Medi-Cal covers, and that month, and which PA I have to fill out. That's a difficult patient for me. But somebody that's upset or because they can't get something, that's a challenging patient. It's not difficult. So we don't allow to have those words that are set up someone to be classified as a difficult patient. And that's what I always tell students or anyone that that is shadowing, or anyone, that there's no such thing as a difficult patient. It's just their challenges. But I don't like to put that as a difficult patient, because they're all challenges. Difficult is finding out those inhalers, and but I just don't feel that emotional intelligence is something that's taught in the classroom. Is something that's lived experience, and having those patients and you see that they're upset, it's how to deal with at that situation, and understanding where they're coming from. And that's what I was saying.
Yeah, thanks for sharing that perspective. So I would just tweak that a little bit, right? Again, this is a psychologist. I mean, a little bit of a reframe, right? Is although it might not be something that, right, I present a topic to you today and you're just going to digest it and be able to regurgitate it, that might not be what's going to happen. It's the practice, right? That's really what we're talking about, which is what you're alluding to, is it's actually seeing the patient, sitting with the patient, and understanding, how do I work through this discomfort, right? What is under this agitation the patient is bringing up, right? Did they just ride 5 bus rides to get here to me, and now I have a 10-minute appointment, and they have a laundry list of what they need to go through. So that's high emotional intelligence, right? And that came through a lot of practice that you've done clearly, and you've really sat with an understanding of what's the difficulty here, right? Is it really the patient? Is it the insurance piece of things, right? Which is what I'm hearing. But again, I encourage you to reflect on that, because many of you are involved in the educational piece of things, of how explicitly do we talk about emotional intelligence, right? Because sometimes, and I heard this in the front, right? As a caretaker, which, I'll just say overarching, that's the statement. As a caretaker, you're taught a lot about what to do for the patient, what to do, whether it's, for productivity, whether it's for your scores in some way, whether it's to help them get better, right? But what about the other person, right? What about yourself? What about the potential trauma that comes with sitting with the patient, right? How do you check in with yourself, and how do you check the other person who you're sharing that space with, right? And that's just as important as the person that's right in front of you, and that mitigates the burnout piece, right, that we're referring to. And traditionally, I will say, I talked a lot about like the clinical spaces, but in leadership spaces, this soft skill isn't discussed too much, with the exception of what you've talked about, right? Like you're looking at the traits or the skills. So again, I just encourage you to continue to have these conversations, especially with the newer folks, because you all have learned this over time, right? You've pulled it in, you've made an effort to, take additional CMEs, or just really work on yourself through personal growth. But there is explicit language now about this, right? And it's important to bring that to folks that are coming after you. So why is this important? We've talked about this at length here, so I won't spend too much time. We know from the literature that it really is effective in physician-patient communication. So the higher your EI, as the person back there, I can't read your name back there, mentioned, right? Like your communication with the patient is a little bit better if you have higher EI, right? You're able to empathize with them a little bit more. It enhances the teamwork and collaboration, reduces burnout. I've talked about that over and over again. Reduces some of that stress, right? Because if you've reframed the patient as not being problematic, but the system, right? It allows you to diffuse that stress a little bit, which kudos to you for doing that. And I put this gentle reminder in here, but over and over again, you've heard me mention, like, you are a caregiver, so empathy, communication, your decision-making is at the core of what you do. So whether you like it or not, emotional intelligence is a part of what you do and is important. And I'll briefly touch on this just for the sake of time. So this was one of the robust articles that I found related to emotional intelligence. And I thought I would share a little bit about some of these domains. So this is a meta-analysis out of the UK. So they were really looking at good medical practice guidelines, and it has 4 domains that they emphasize: knowledge, skills, performance, safety and quality, communication, partnership, teamwork, and maintaining trust. And I encourage you to look at this study, but the first domain, what they found was the higher your EI, they found that it was correlated with actually improved situational judgment for surgery residents, which makes a lot of sense, right? So the higher your EI, the more effectively you're able to make decisions when you're doing surgery. And for the second domain, in terms of safety and quality, they found that the higher your emotional intelligence was, the safer you were in practice. And, if we really distill that down, if you know what your strengths and weaknesses are, you're going to be safer in your practice, right? You know when to collaborate with other folks, when to pull somebody in, when to, do a consult. And I'm using phone with my fingers, but, that really helps you mitigate some of those safety components that can come up in your practice. And over time, a lot of people start feeling confident in certain things, and it's good to consult. It's good to reach out to your contacts, right? And for the third domain, I thought this was really interesting. So they looked at a study, and pre and post surgery, they looked at folks with higher emotional intelligence, so providers, and how that correlated with patient satisfaction. And what they found was that the folks that had higher emotional intelligence, their patients rated them as being more satisfied pre and post surgery, but that effect didn't stay long term. So it was only for that pre and post. It was not long term. And one interesting bit that I wanted to bring up, because I think this came up briefly, and I am really interested in hospice, palliative care, end of life work. That's a part of what I do in my other side of my work. And what they found was that unfortunately, higher emotional intelligence actually is not related to the delivery of death news, right? So anything related to like someone passing away or, the complexity of that delivery of news. So that was really interesting, but again, there's limited literature there. I would love for somebody to do more work on that. I know it's a really difficult space, but it is something that requires recognition, right? Delivering really difficult news, depending on the specialty that you're working in, is difficult regardless of how high your emotional intelligence is, right? You're human at the end of the day. And then maintaining trust. So, there's complex literature out there when it comes to medicine. They found that, for physicians who were higher in emotional intelligence and they were rating patient satisfaction, they actually found that the physician's self-rating was not related to like patient outcomes in any ways. But what was interesting was in the same study, they had nurses rate the physicians, and they found that emotional intelligence piece, right, how the nurses rated the physicians and the trust that they found in the patient actually did have a correlation. So interesting, but again, a lot of limitations to the work when it's specific to the world of medicine. And as I was kind of going through the literature, what I also found was, there's no consistency, and you have to really look at the limitations when it comes to emotional intelligence as a measure, because there's that trait versus ability factor. A lot of these studies don't have consistency in the types of measures that they're using. So, take that with a grain of salt. They're not really factoring in culture into a lot of these studies either, right? So that's important to look at when you're looking at the results of these studies. But overall, what the meta-analysis concluded was that higher emotional intelligence helps you to be in alignment with your practice guidelines, right? And there was one particular study related to the ACGME competencies, and they found that folks with higher emotional intelligence actually were more consistent with those competencies. So again, take it with a grain of salt, but the larger literature does support this. And what you all kind of came here for. So what are some practical strategies, right? And I encourage you all to think about your well-being as you look at these types of emotional intelligence strategies, and also look at the tools that are provided to you by SSVMS. There is the Joy in Medicine resiliency consultation, right? Like those 5 or 6 therapy sessions that you can utilize to foster some of this if you're struggling with it as well. So a little plug there for that. So there's gonna be 10 of these components that you can work on a daily basis. I had you all kind of do this at the beginning, but clarifying your intention, right? And so when we talk about this, when it comes to your workspace, right, it's really, when I'm coming into work, if I work with really challenging colleagues or really challenging patients, right, whatever that means for you, what is a skill set that maybe I need to work on today? Do I need to do something to keep my cool, right? Do I need to continue to have a conversation with myself of I need to remain calm? That's what I'm going to work on today. How do I build this understanding? And do I need to listen more than I speak, right? Is that feedback that I'm continuously getting from someone, and is it something I need to work on? And each day brings different things that we all need to work on, right? But again, that continuing conversation of what's my intention, what am I working on? And that creates a lot of awareness, right? Because most of us don't check in with ourselves. We're on autopilot from the time we leave our house to get to work, and then we go into patient care. And self-care. I think this word is overused and abused at this point. But, you know, I would just encourage you to really think about self-care as something really manageable for you and where you are in life, right? All of us go through seasons where we don't have an hour and a half to dedicate to exercise. I loved that phase of my life where I could do that. I'm not there anymore. So what does self-care look like? Maybe it's I eat my lunch and I go for a 20-minute walk. Do I take a walk every night after I'm done with patient care? Do I pack my lunch, right? Because I'm pretty bad at maybe eating out, right? So what does self-care look like for you? And I am really intrigued by some of the lifestyle medicine work that's going on. And so that has a lot of work in there too, right? It's really related to nutrition. So how are you eating? And what kind of physical activity are you getting? Are you using these watches that we all wear in an effective way, right? I try to keep them so that I actually know if I'm getting to the steps that, I'm aiming for. Am I getting enough sleep? I know I'm not good when I don't get enough sleep. Am I drinking too much caffeine? I think all of us are probably guilty of that, and that will give you anxiety, right? So how are you doing with that? How are you managing your stress? Because what happens at home is going to affect your work life as well, right? So what's going on at home? Is there an awareness of that? Are you connecting to the folks that you're living with? And I talked about caffeine, but other substances, are you struggling with alcohol? Are you struggling with other things that, you might be intaking that might not be so healthy for you because you're feeling a little burnt out? And this really builds on that self-care piece. This is that emotional checkup that most of us don't do. I found a really great app. It's for free. It's called How We Feel, and it allows you to check in about feelings. It names the feelings for you, so you don't even have to do the work. You just click on the feelings, and you can tell the app how many times a day you want the app to check in with you. All the good stuff is there. Apple products have all of this built in as well, so it really depends on what works for you. But essentially, that physical and emotional connection, right? Am I really tensed up? Are my shoulders like completely up here, right? And like, where's that coming from? Why is that happening? Most of the time, right, when you're going from one thing to the next, you're not paying attention to what's going on in your body. So just like you're telling your patients to do, I encourage you to do the same, right? And figure out, how do you get your body to be less tense? How do I do some little tweaks to make that happen? Again, it might not be an hour and a half of a massage or whatever it might be, but maybe it looks like a walk or a talk with your favorite person. This is very difficult for most of us, with productivity being at the core of what many of us do. But how are you slowing down, right? What is your routine between patients? How do you take a breath, or are you going from one room to the next, right? And I really encourage you to look at what your routine looks like and be really intentional about this, because this will cause you to burn out after a certain amount of time, right? When you go next. So it doesn't mean that you have to sit around and kumbaya with yourself. It really is, can I take a deep breath? And can I just say, all right, that was a hard session, and now or that was a hard patient, or that was a hard situation, and now I have to move into the next space. It's really allowing yourself that little, 10, 20 seconds to transition. And I encourage you to think really intentionally, right? Many of us know these concepts, but it's being intentional about creating effective routines for yourself. And that's the difference between just reading something and implementing it. And get curious. So this goes back to what someone in the back said, right? Is it really a hard patient, or is it something else going on, right? How do I better understand someone's perspective? Maybe we can't focus on every single issue that they're, right, the laundry list they're coming in with, but we prioritize that list, right? But how do we also pause for a moment and discuss the really hard things that happened? Maybe their loved one passed away tragically, right? And I don't know about you, but the moments that my providers have paused and, even that, again, 20 seconds, they paused and said, I'm really sorry for your loss. I'm really sorry that happened. That was effective enough for me, right? So really think about that experience you have as a human being, and I encourage you to see how can I bring that into spaces for my patients. So again, it's not doing a therapy session with them. It's really being human and allowing yourself to have a candid conversation with them. And again, there's ways to contain that and ways to work through that, and I encourage you to cultivate that curiosity and see how are we gonna, how am I gonna build my empathy and maintain my practice, right? You all came into this profession because you care about folks, and burning out doesn't feel very good because you're chipping away at the core of who you are at times. Creating space. So emotionally intelligent people are also good at understanding their weaknesses, right? And areas of growth, or whatever you would like to call it. And it's really looking at, am I willing to change course? If something is, a weakness of mine, am I willing to build on that and practice that and work on it? Maybe I'm not good at listening to other people. Maybe I talk a lot more than I listen. And so how do I create space for that, and how do I create opportunities to practice that on a daily basis? Because you all have many opportunities within medical school, residency, within your practices, within your personal lives, right? You have the luxury of actually having that in many areas of your life. I guess we could call that a luxury or not. And we talk about our feelings in many areas, right? So again, where are you struggling? What are the emotions that are negative that are coming up that you might not be creating space for? Reading the room. This is really difficult for some folks, right? And we've all been there where we're deep in a conversation, somebody comes through and totally changes the dynamic of a meeting as they walk through, with their piles of stuff or whatever it may be. So, again, this goes back to that pausing and reflecting. So read the room, right? What's the context? What's happening? Are people multitasking, right? Many of us do have a lot of virtual meetings, and we all do this. I do it myself. So, how do I read the room, and when is it appropriate to do that? Is it appropriate to be multitasking during my 5-minute huddle? Can I take a moment, and just be in this space? So again, it's really taking those moments of reflection and reading the room and really reading the emotion that's in the room. And that comes up in patient care as well. Making an effort to connect. So this goes back to my MA story, right, that I gave. You have other teammates outside of, right, the professionals that have the same degree as you. So how are you greeting folks when you come in? Do you just rush into your office, right? Or do you say hi and hello? Or, do you go on a walk together at lunch? And some of the folks that I know to have higher, emotional intelligence, they make a real effort to get to know the people that they work with, right? Maybe your MA is really short today. What happened? Maybe their kid is sick, and they came to work and they had to get childcare and X, Y, and Z. But if you didn't know that backstory, you didn't know that context, it would probably piss you off too, right? You'd be mad just like them. So again, making those efforts to connect, making a walk to the cafeteria or lab or really having thoughtful interactions about how was your weekend, or how are you today, or what's your favorite X, Y, and Z. These are really small interactions. You're not taking, again, 30 minutes to do this. Sometimes you may have time to do that, and other times you don't. It may just be, a quick hi, hello, or whatever that interaction is at the beginning. Cleaning up your messes becomes really important. So this is, and I'm using these MA stories as really examples here, but if you do get short with somebody, is it okay to apologize? Because we are human, right? You have your days where you're upset about things, and a highly, emotionally intelligent person is able to understand their shortcomings, right? I had a difficult day. I'm really sorry. Can we have those genuine apologies, right? And we all know what genuine looks like, right? So really thinking through, how do I have those candid conversations with the folks that I'm working with, even when there's discomfort involved with that. And again, maintaining that authenticity of who you are. And that's difficult for some people more than others. But again, part of having higher emotional intelligence is knowing your strengths and weaknesses. And beginning and ending well. So what are your routines, right? What's your morning ritual look like? And, think a little bit about this. Is it being on social media first thing in the morning? Or is it, for some people, they need to pray in the morning. For other people, they have a mindfulness practice. For other people, it's listening to their favorite music. So really think about, how am I going to start and end my day, right? How do I transition from being mom to being provider? And how do I end being provider to being mom, or being somebody's child, or, whatever your title is outside of your workspace? Because your burnout impacts everybody around you, right? So it will seep into your life if you let it. I'm gonna quickly move through these because I'm limited on time, but emotional intelligence is associated with lower perceptions of stress, better quality of life, increased empathy, which we heard from some folks in the room today, increased social support, as well as increased subjective happiness and better quality of life. So this benefits you in all areas of your life, in your well-being as well as happiness. I thought I would put this in here because some of you all are leaders, well, all of you are leaders, but some of you may be curious about how emotional intelligence and leadership during COVID-19 came through. And this is a very small study that was done. There was semi-structured interviews of about 7 to 8 leaders in medicine. And what they found was that these strategies were during uncertain times, these were the effective strategies that pulled through for folks with higher emotional intelligence. So communication, interpersonal collaboration, internal and external awareness, trust and safety. So really, folks being transparent about the decisions that were being made, really communicating with their teams, seeking out feedback, right? And having an awareness about the impact of the decisions that were being made and how their teams were being impacted by that, and how, they built that trust, again, that transparency piece of things. So to end, I would say, I encourage you all to remember that emotional intelligence is an asset. It's a tool that you can utilize to have overall well-being, right? It's well-being for your professional and your personal lives, and it is something that can be practiced. It's a skill that you can learn about, and then you go out into the world and practice. And I just encourage you all to identify, utilize, understand, and regulate as you need. And again, this PowerPoint, I'm happy to make it available, and is really simple skills that you can all use to begin your journey. So just, again, I'm leaving you all with a quote. A simple act of caring is heroic, right? We talked about productivity, and we talked about how do we make space for some of these difficult conversations. But the fact that you're caring and you're with somebody through a difficult part of their life, like, that is enough. And I hope you all remember that and remember the core of your why, and continue to do what you love and for a really long time. All right, so that is it for me. Any questions or thoughts? Or I put my email address at the end too. You're welcome. Yes, I see your hand.
Hello, thank you so much for your talk. This is a wonderful topic. One question I had is, as a medical student, we've been taught the importance of empathy, right? Talking with patients. So whenever we have a patient say like, oh, my parents passed away, then we say, oh, I'm so sorry for your loss. But I feel like that's something we've been taught, so it becomes like protocol the more you do it. So how do you find that balance between following the procedure and actually being genuine about like your empathy?
Yeah, so that's a great question. So it reminds me of, it's not what you say, but how you say it, right? So how do you pull for that genuine, right? That genuine part of yourself, and what's genuine in that moment. And you may have to tweak those words a little bit every time you say them. But as long as you mean what you say, right, that really will pull through. And I just encourage you to think about what feels comfortable in that moment versus the script that you've been taught, right? So really pulling for who are you, and how do you relay that message to a patient. And that might be different than the way I say things, right? Just like Dr. Chuck is going to be different than the way I say things.
Thank you.
We have time for one more question.
I was going to say, we went to a really wonderful leadership session yesterday. I'm just coming off the heels of that.
Yeah.
And we had Dr. Tom Lee from the Press Ganey come and talk. He's a cardiologist from Harvard.
Mm-hmm.
And he said, and this, I believe he said it came from Confucius, but it was such an amazing quote where he said that we need to behave as though we are what we ought to be. And to me, that hits that. You are learning to behave as though you are what you ought to be. So you are building that routine in, and then it will just become who you are. And then it will follow, like the emotion, the pathways, the connections will follow. But you're learning it so that it's when you are not your best, you're still asking the question, and you're reflecting what you should be saying. And it's just, I think it's going to help build you to it's going to come. It'll naturally come.
Yeah.
Yeah.
And, there is this perfectionistic quality about medicine, right? We all want to be perfect in what we do. But remember, you will make mistakes. And you will have days where you're disingenuous about what you're saying because you've got the next thing to do. And it's not about making the mistake, it's what you take away from that mistake, right? And so really learning from those opportunities, and you will have them throughout your career. So I just encourage you to be open to learning.
Have a big round of applause.